Good morning, everyone. I'm Joe Sierra with STI. Thank you for attending today. A couple of pieces of trivia before we get started. Chris Fisher is here. She's the moderator. Please have your microphone muted. And if you have questions, submit those via the chat option on the screen. I'm going to take about 5 minutes to talk about some things that I think are important. Then I'm going to pass this on to Matt Ross. He's going to talk about credentialing. And then at 9:30 we'll have some time for questions and answers. And I'm pretty sure we'll get you out of here pretty much by 9:30. Next slide, please. First off, if you'd like to get a bigger presentation on your screen, in the center of your screen, you're going to see Go To menu. If you click that and you hide everyone, you're going to not see people's faces. Instead, you'll see a bigger presentation. I like doing that only because it allows me to get a bigger screen to look at. Next slide. I'm sure everybody has noticed that since March of 2020, everything has changed. There was actually a book came out probably pretty close to 15, 20 years ago now by Tom Friedman called The World is Flat. And the concept was that the personal computer and the internet in the future is going to change everything because there's no need to work at the office anymore. You can access what we call the cloud, which is nothing more than servers up in another location from anywhere. And that was pretty much true for most industries, but not so much for the medical industry because of our needs for hands-on access with patients. But once COVID hit, all of that changed in a couple of ways. The first way was the ability to do telemedicine visits, where you have the ability to see your EMR on your screen at the same time you're seeing the patient's face and be able to conduct meetings. And Medicare went ahead and paid us the same way for a visit on telemedicine as they did with an on-site visit. The other thing that's happened is everything became more complicated with insurance programs, and you really need help with someone to take care of the technology. Back in the 1990s, we could give you a server, and it was pretty much a simple little device that you could work with. But now we're finding that the servers are more expensive, they're more complicated, we need updates, and all of a sudden they become problematic for most small practices. And our goal at STI is to help you survive the 21st century. Next slide. The other thing that has changed, and I find this to be an incredible number, but I checked it out, it's true, that since COVID, 1 in 5 healthcare workers have quit their job. So we lost 20% of our people in the past 2 years. And a lot of that is experienced billers are retiring. Younger people don't want to work in an office and they're concerned about COVID. They don't want to work in a medical office because they're afraid they're going to get COVID and bring it home to their family. And all of a sudden we find we have a labor shortage in the country and particularly in the medical industry. So we're trying to find ways that you can focus your limited staff more on working with patients than doing things like billing and collecting and sitting on the phone trying to talk to insurance companies. And we have a solution for that, and we'll talk about that in a minute. Next slide. The other thing that we've been noticing is this problem with ransomware. We've seen hospitals, one Hackensack General got hit with ransomware. We've had practices get hit with ransomware. And all of a sudden what happens is with servers in-house, people aren't putting all of their updates on those servers. And what's happening is one of your employees could pull in a virus and it would lock up your server and all your data. And as we know in medicine, there's a lot of valuable data there. Social Security numbers, credit card numbers, all kinds of information that people want to get their hands on. And if you're not doing a good backup, once that data is locked, you have no choice but to pay a ransom to get your data back. This is less of a concern if you're using a cloud-based system because it's being managed by a professional staff that's going to do the updates for Microsoft as well as for STI, as well as backing up multiple times during the day. So if you do get a ransomware attack, we can restore data for you. So we're really encouraging our clients to look at the cloud-based solution of our software. It's exactly the same software, just as being managed for you by STI's technical department. Next slide. We've also brought out a lot of new products. Our last webinar was really exciting, was about the ability to send out patient bill pay reminders. We can allow patients to pay their bill online. We have e-faxing. We have managed services. There's a lot of new products available. We're not going to go over those today, but just be aware that if you haven't talked to someone at STI recently, you probably don't know about a lot of these products. Next slide. Finally, I want to just talk a little bit about what we call revenue cycle management, or revenue cycle optimization through an STI billing partner. We have the ability to help practices that are having a difficult time doing billing by sharing a cloud-based technology, and we have people available. If your staff, and we've had a lot of phone calls with practices that can't replace billers. So we have billing partners that can help you with your billing. They have knowledge on MIPS and ACO. They can put the data up in the cloud where you can view it, and it allows you to have your limited staff work on taking care of patients and let us help you with the back-end processing so that your staff's not sitting on the phone waiting to talk to the insurance company. An RCM partner can do that for you. So now I'm going to turn this over to Matt Ross, who's going to talk about today's topic, which is credentialing. And I'll be back a little later to talk about questions. It's all yours, Matt.
Hey, thanks, Joe. I appreciate that. I mean, what's pretty evident through the course of what was just discussed by Joe, a few moments ago, is something that we're aware of, is just the continual change of what's happening within our industry. One of the things when you look at what is a priority from days past to what it is now, is the provider most critical in treating the patient? Most certainly. Where is our priority in terms of the importance of staff and assisting the providers and the teams? How critical is the income to support the organization and the team? Most certainly a key element. And what about compliance, and where does compliance fit, that almighty word that we're all beginning to hate more and more, as Joe was just indicating, between the necessities of cybersecurity and what's happening not only in HR, but in revenue cycle management? It's hard to understand what is most critical, even from the compliance perspective of what we make. How much are these payers willing or wanting to take back for reasons of us maybe not doing the right thing? So, when you talk about the word of credentialing, and to try to keep this in the G-rated program, but there's certainly a four-letter word that comes to my mind in the manner of years of being involved in healthcare and healthcare reimbursement. But most certainly it's the frustration, the time-consuming element that credentialing brings up, how the fact that it's tedious, confusing. Many times we just feel that it's ineffective, that I'm filling out forms over and over again. It's very frustrating and expensive on our time and the things that we need to do. Probably most certainly is a fact that it's just an unwelcome distraction throughout the day-to-day, yet it still has to be done. It's another component into healthcare that's so critically necessary in our healthcare delivery system. In fact, the Joint Commission describes credentialing, medical credentialing, as a process of obtaining, verifying, and assessing the qualifications of a practitioner to provide care or services in a healthcare organization. Credentials are documented evidence of licensure, education, training, experience, and other qualifications. Now, certainly the Joint Commission puts a statement out. Sounds pretty explicit, seems relatively easy. For those of us that are involved in credentialing and running our practices, we know it's anything but that. It's certainly not logical. Most certainly isn't predictable based upon the documents, the emails, the correspondence that we receive. And arguably, it is not a reasonable process by any means. It's extremely frustrating, as we're all becoming very aware of this. And a lot of this, quite frankly, has been started through the Affordable Care Act, has really enhanced and elevated the necessity, the requirement of credentialing. And things that come to mind, whether you've been a part of credentialing, whether you've known it through the course of your career, whether you're new to it, common terms, PCOS, Medicare, the old Medicare 855 CMS forms, board certification. Now there's these exclusion data banks that need to be filled out on an annualized basis, peer reviews, how critical these are, attesting to whether it be CAQH, NPI, dealing with NCQA requirements. All of these elements are part of this simple definition, as so the Joint Commission exclaims to us, a part of credentialing that is critical to today's continuation of insurance participation and our ability to be able to deliver health care and actually be paid for that. Now, for those of you that can remember, it wasn't that far ago that specialists such as anesthesiologists in the past would never need to be credentialed for the services that they perform. All of that has changed so much in these last 25 years, more than ever before. And certainly today, when you look at the high deductible healthcare plan systems that are out there, that really are forcing the providers to become more in-network so that they can seek reimbursement for their services. These days of participation are here, and unless there's some radical change into a different delivery system, which is a whole different topic, where we are today with credentialing is where it is at this moment. But who does it affect? It's not just physicians. It's not just hospitals. It's chiropractors. It's PT. It's OT. It's optometry offices. It's ASCs, urgent care centers, ambulance organizations, clinics of any kind, whether they be in Article 28, Article 31, diagnostic and sleep centers. All of these organizations, virtually any provider that wants to seek reimbursement and be quote unquote in network must go through some form of credentialing process today. And how do I do that? What is it that I need to do? Regretfully, there's still not a standardized format, albeit some movement towards this, but the credentialing process requires online applications. It can require unique legacy papers. It will necessitate some documents to be notarized. There may be some that can be e-signed. The process for credentialing is still not standardized, which is also some of the reasons why it's so complex and why there are so many changes. Its credentialing encompasses new enrollments, whether it be a new organization, a new NPI, a new tax ID number, new providers that come into those organizations, terminated providers, whether it be a physician, an extender, whether it be even in some cases RNs, depending upon the specialty. There may be a specific requirement for qualification for a credentialing necessity. An update to the demographic data. No longer is it not important to worry about what your hours of operation are. Now, I'll discuss with you in a few moments how any changes within your individual practice, from days of operation to hours of operation to what locations and who, are all part of this credentialing process that are critical. Reappointments and recredentialing. Back in the day, you would fill out a simple piece of paper that would say, hey, I want to participate with Blue Cross and Blue Shield or Excellus. Even Medicare's process was very simplistic. Today, reappointments, recredentialing are all part of this credentialing word. And there's a necessity for us to be maintaining accurate files because it's another component within healthcare that is foilable, which is deliverable, and also falls within the world of compliance. Provider maintenance. It sounds simple enough to just get the, I should retract that statement, it's more complex just to get the enrollments out. Now the provider maintenance requirements for attesting to what you do day in, day out is now becoming a requirement within a month-to-month event, where once before it could maybe be 2 every 3 years. We'll discuss with you very shortly about how the provider maintenance has entered the world into credentialing. Medical staff privileging and appointments as well, all part of what falls within the credentialing world. So, you know, what is it really? What is it for? Well, there is, as much as anyone that's gone through the process of credentialing and the laborious pain that it enacts upon us, there is value to that. And the NCQA, the National Committee for Quality Assurance, one of the reasons why these insurance companies cannot fast pass these applications, as many times as I personally have been involved in some of these committee meetings with these carriers, is because there are standards that need to be met, which protects the patients. And it protects us and our practices as well. We don't want to be bringing in a provider that is going to be treating a patient that we ultimately find out is incapable or clinically not able to perform those services. It helps mitigate those lawsuits and also establishes the value to the reputation by bringing in good qualified providers. There are some changes that have occurred, more known now by the Surprises Act that came about in January 1st, 2022, both at a federal level and also at a state level, that is making credentialing a critical requirement. The big thing, which I've highlighted here, that while there's an understanding of the compliance aspect and certainly the regulatory requirement to do that, and from a safety perspective, the impacts of the financial side of preventing loss is can't ever be more known. Now, here's a couple points just so that you can understand. MGMA conducted a survey. Healthcare leaders responded. Over half of all of the denials through the poll that the MGMA received has something to do with provider credentialing. It could be something as provider not on file. That provider is not able to perform these services. It could be an incorrect specialty listed for that particular provider. All of these types of denials, if you talk to your billing team, your RCM organization, this is becoming a larger component of the denials that we receive, getting back to the importance of credentialing within your profile. In 2019, Merritt and Hawkins qualified that on average, $10,000 per day can be lost through the advent of not properly enrolling or maintaining the credentialing file for an individual provider. Here's a real fact that we can validate. Horizon Blue Cross and Blue Shield representatives have actually told our team members that they're so backed up that they're being instructed to literally delete, throw away provider applications. WellCare and other insurance companies, this is not another uncommon feat, that are paying providers improperly due to the wrong tax ID. So dollars are being paid for you or for other providers to some other organization by improperly handling of paperwork. This can be done both at the provider level, but we're also seeing this, quite frankly, at the insurance, and their excuses are, we're understaffed. Well, you know, that excuse is no longer allowed. Well, all right, I've got an easy solution to that, right? Well, just bill it underneath me. Don't worry about this credentialing headache. Bill it underneath my ID number, and we'll get to it when we get to it. Well, I can tell you that regretfully, this happens, and you're vaguely misunderstood over the criticalness of how that is inaccurate. Not only can a physician not be billed underneath another physician. But until a provider is gone through an enrollment process, you are not even allowed to bill a nurse practitioner or a physician assistant underneath the supervising physician until they've completed their enrollment. All of these of just bill it out underneath a different NPI to get the claim paid for the continuity of cash flow is something that we can't do, yet from a business perspective, it's understood why, especially when we all are frustrated over the process taking, in some cases, 6 months or longer to get a provider credentialed based upon unusual circumstances. The key is we want to mitigate that problem and get them enrolled as quickly as possible in doing it as fast as we can and done the right way. The last thing we want to be doing is have an antitrust claim for a false filing, or worse still, getting a letter from the HHS due to a fraud issue or a retraction by the insurance company. And it's separate from the fact of attaining the dollars. Give a thought over a provider who's trying to actually authorize care. So from a patient care perspective, if you had another physician, a physician assistant, an NP, an APP extender, he or she is not actually able to write a script or get an authorization for testing unless they are truly within that system of credentialing. I touched upon a little bit earlier about some changes within the federal government. The No Surprises Act has really buckled down some things which are critically important beyond the fact of things that are called or relating to giving specific dollar amounts of informing the patients of what the healthcare costs are. But underneath the No Surprises Act, the government rolled out these new stipulations. Many are not aware. The fact is, it's actually the law today. And the fines are up to $10,000 per violation if they are not being followed. And what does that mean? That is now the law to ensure that there's continuity of care by maintaining the directories for all of the providers of service within your organization. That has to happen in the beginning of the network. It has to happen at any change, whether it be, as I mentioned earlier, something relating to hours of operation, days of operation, what location. It is now a requirement per the No Surprises Act that these material changes have to be understood and they have to be conveyed every single 30 days because the healthcare institutions, the payers, have a requirement to be posting on their websites and their information, what is their current profile, who is participating, who is enrolled. On top of this federal requirement and state changes is that if by chance the providers and the healthcare system are not maintaining accuracy of medical records, we actually may need to reimburse patients if they were seeing a member within a health system that they believe was a network and they truly are not, which is going to, I believe, pose, based on the discussions that I've had with other professionals and other consortiums, is going to be something we're going to be seeing much greater in 2023. So now that I've got us all anxious potentially over this, what we thought to be not an important task, more frustrating, how do I get it done within the time frame that I don't have? Well, because of the strength of our organization at STI, from our RCM divisions, our knowledge base from compliance and EHR, from our practice management and consulting services, we're here to help eliminate those headaches by taking those pains and assisting you through the process of taking on all that enrollment task, all the maintenance of those files, and allowing us to free yourself from needing to keep track of all these requirements, not worrying about the financial risks that you may be subject to, allowing you to focus your time on what you do best or maybe what you need to do. Joe alluded to this a little bit earlier about focusing on the patients, the delivery of healthcare. Credentialing is one more mess. It is, there's no value to it. We don't see, it's not like a construction worker that can see them actually moving a pile of dirt. credentialing is just one more headache that you have to get through, and if you don't, there's just simply penalties that will be ensued or losses, and you want to have a peace of mind knowing that you can sleep at night, you don't have to worry about a letter, and that you can continue to see patients and focus on the things that you need to. Allow our team here at STI, who has knowledge and focus and dedicated. Our organization has not only specialists but certified individuals who will solely and focus their day in, their day out, and making sure that their primary responsibility is maintaining the profile of the credentialing for our providers and our team members. We have broad knowledge. We've been doing this for years, and now we are making sure that our clients, our partners, all of us are making sure that they're doing what they need to do through our systematic processes and our specialized technology. One of the things that we do utilize to help us is some technologies to help keep ourselves organized, because there are so many things in today's environment of maintaining documentation that are critical to be able to get your hands on. And after that is making sure that we communicate with our providers and strategize about which type of insurance companies and payers that we actually want to be enrolled with. Now, what part of the credentialing process are we able to handle? All of it, from new providers, new groups, making sure that commercial payers at a national level or a local level, from Blue Cross Blue Shield, United Healthcare, CMS, including Palmetto, DME programs, state workers' compensation where applicable, maintaining CAQH, NPI profiles, the recredentialing, the demographic updates, the provider terminations, the reappointments, the credentialing, and one of the things I want to talk about is the maintenance program and what's so critical about a maintenance program. Well, let me just share a letter that we've actually received from one of our clients from a carrier in the state of New York, Fidelis. And this letter came through and it says, at this time, Fidelis has decided to terminate your participation status for all Fidelis Care sponsored programs due to the fact that you have not provided the requested information to complete your credentialing packet within the designated time frame. Thereby, your provider agreement is terminated. So when we received this letter from our healthcare provider, is fortunately they were on our maintenance program, and because we have very explicit documentation and we track and maintain all of the notices that we send, all of the electronic documents, certified documents. We have a full history of everything that we do for all of our clients. Fidelis came back, redacted the letter and said, oops, sorry, we do see that you sent that. Then only through the diligence by having a dedicated maintenance program have we been able to make sure that we track all the required regulatory changes, making sure that Medicare, Medicaid, commercial payers, all of the recredentialing that is necessary for all of our commercial payers is part of what we do in our maintenance program. No longer do you need to be worrying about, is it biannual, is it bi-monthly, is it every quarter? We handle the recredentialing, the reattestations, whether it be CAQH, NPI, any contract amendments that might come through. For those of you that might see, and this is something that comes up regretfully again quite often, is solving issues related to claim problems. You receive a notice on an EOB that says, we are not paying this service because a provider couldn't perform these services or not on file and so forth. Our maintenance team, our specialists, assists our provider groups by providing the information back to that carrier to show them that they were wrong, so that most importantly, that the revenue streams can continue to come through. We advise our team members, our providers, our organizations, and our partners about changes to expirations when they come due, whether it be annualized attestations, whether it be new documents that are required for whatever reasons or amendments that these payers want to be informing us or pushing down the requirements of participation, and keeping monthly or biweekly meetings when required for our clients. The process in which we do this is pretty simple. We've got a tried and true system of an internal application process that captures all the information that we need. We do this once with our providers, gathering licensure information, board certifications, driver's license, if needed, EC, FM, and Gs, malpractice, virtually everything with the exception, I think, of maybe your favorite color, maybe what your favorite book, because what we don't want to have to do is be bothering you about we need this piece of paper. However, I will say what our team does do is make sure that we have the most current information on file, because like that letter that I showed you prior to, our best defense is our greatest offense of showing the carriers, including CMS, that we have everything on file, and if they made that mistake, we don't want that to be a cause of harm financially or clinically for our providers and our clients. Making sure that we've got, after all this is done, we've got systems for our share file, electronic signing where necessary to simplify the process for you. We have a very dedicated system on how these applications get submitted. And depending upon the carrier, is that we can also help conduct a contract review, making sure that do you even want to participate with this insurance company? We find that some providers will realize, you mean I'm only getting paid 50 cents on the Medicare dollar or even less than that? Looking at the contracts is a whole other component. I'm not going to talk about this in today's program, but reviewing fee schedules is becoming a larger part of understanding who you should participate with and who you shouldn't. So if I still have any viewers out there or I haven't bored you to death, is that hopefully you'll get a good understanding of, all right, there's a lot to this, and maybe I do need to focus my time, and how do I do that? We have developed at STI a particular rate card, and this rate card helps us better understand what the needs are of our clients, and also when we have a one-on-one conversation with you in a very short order, we can put together a program, and where applicable, depending upon the size, if necessary, discounting pricing or specialized pricing based upon the type of enrollment, whether it be payer, whether it be Medicare, Medicaid, whether you need recredentialing, whether you have a situation even that is you've been terminated, you're not part of our team here yet at STI, but you don't know how to resolve this problem of a termination, we have ways to help you, and we can have that conversation with you and discuss what those costs are today. We look forward to being able to provide to our clients on a continual basis and going forward. We've got dedicated teams. We know the importance of credentialing and enrollment. We know it's certainly not going away, and we want to instill the confidence with all of you to be able to provide you the comfort to focus on what you need to and not anything else. So Chris, I'm not sure if we've had any questions that have come through or not. Now's probably not a bad time. And I'm sorry that I went a little bit over everyone. Joe, you indicated 9:30. I apologize to us all.
At this point, there are no questions. We certainly have a few minutes. If you'd like to submit a question, we'd be happy to answer it for you.
Yeah, while you're thinking, let me just tell you about what's coming up. We have typically 3 webinars a month. One is about revenue cycle optimization and why we think you should be using a billing partner to do your billing. That's going to be held on October 5th. We also have a session similar to that, really designed for medical centers and surgical centers, because we are working with surgical centers and hospitals and doing billing for them as well. And then, of course, we have these user group meetings that we do once a month. The next one is scheduled for 10/26. Below that, there's contact information. You want to get a hold of Matt or myself or Chris, and I'm sure Rose will be contacting you to see if you have any questions afterwards. And don't forget, if you need to review this, it's going to be on our website. So last chance on questions, Chris.
Yes, Joe, here's one. What is the pricing structure for credentialing?
So probably, I think the best thing, if we could, just because we want to be making sure we understand critically all that, is it possible that we could have that respondent send something over specifically? I'd be more than happy to have a one-on-one conversation understanding what those needs are.
Here's another question. So we have to resubmit all of this information to STI. I don't even know where my ECFMG reports are from 45 years ago. I already do this every few months whenever I receive a notice from CAQH. So how is this different?
So I'm going to just answer at kind of a high level. So not knowing yet which particular insurance companies that individual, the provider, that group participates with, CAQH is only one component, and also the Council for Affordable Care or Quality Health Care does not encompass all of the payers. For example, United Healthcare is an organization, or we know UHC, right, nationally, does not use CAQH. There are other insurance companies that are not fundamentally using CAQH alone for that. So in response to that is the recertifications for Medicare and state Medicaid programs don't fall underneath that. In terms of attaining the information, we do have the ability, working through some of the agencies, to get that, but we could have a dialogue and make sure that we have everything on file. If you don't have an ECFM&G on file, I would have to talk to one of our specialists and our manager to see how we can obtain that and if it's even going to be necessary. The CAQH attestation, you've got to be making sure that you're not just clicking it and that all that data inside that is accurate, and that may come back at you at a later point in time. So very broad, maybe a more specified conversation with our team members and that individual, I could help better answer that.
Okay,
Anything
thank you,
else?
Matt. At this point, there are no other questions.
Okay, great. Well, thank you everybody for attending today. As I mentioned, this will be on our website if you want to take a look at it. And I encourage you, if you have any questions you want to take offline, I would recommend you call Matt Ross. He's probably the expert on this at STI, and his extension is 1169. He can get back to you, or you can email him. Again, thank you for attending, and hopefully we'll see you at the next user group meeting.
Thank you very much, everyone.